I am Mervyn Richards, and I have hypertension or high blood pressure. I take my medication, and when I take my medication, I take 1 tablet per day before 10 in the mornings. Sometimes when I forget to take my medication, I have concerns about the impact or the side effect it will have on my body.
Not taking medication as prescribed increases the chance of hospitalization. It creates possible unwanted side effects. It can also create new disorders. It can cause your current illness or uncontrolled illness to be worse and could possibly lead to death. So it is very important to follow the instruction as prescribed. Have a discussion with your healthcare provider, be it your doctor, nurse, your pharmacist. Talk about the medication, how you're feeling. Get the information about the effectiveness of the medication. What are the possible drug interaction or side effects? Read the labels carefully and clarify any doubt that you may have. There are several reasons why medications may be prescribed. 1, treating temporary ailment, and 2, managing chronic disease. A prescribed medication is studied well before it is approved for public distribution. During these preliminary studies, a recommended method of use is obtained. If you take 2 less in terms of dosage amount or dosage frequency, you will not receive the maximum benefit from this prescribed medication. So it is important to discuss with your doctor or your pharmacist before experimenting with medication. Some of the ways that we can promote adherence to medication use, in addition to talking to your doctor or your pharmacist, would include looking at your diet, getting regular physical exercise, getting sufficient or adequate water daily. Some of the medication may cause dehydration, so it is very important that you have adequate water. Getting enough sleep is also important. When the body is well rested, the cells are rejuvenated and you are recharged to take on the challenges of the new day.
We want our beneficiaries to have the maximum use of their medication. This includes strategies such as having a daily routine, tracking your medication use with a weekly pill box, filling your prescriptions 5 to 7 days before your last pill, and, should you have any concerns, talking to your doctor or pharmacist. Our qualified team of pharmacists are here to serve you, our deserving beneficiaries. Whether you're a new patient or one that regularly visits our pharmacy, you are encouraged to contact us via telephone, email, or in person. Currently, the Medical Benefit Scheme spends upwards of $30 million EC on pharmaceuticals.
When I do take my medication prescribed by my doctor, I know it prevents my condition from worsening, from hospitalization, and even death. That's enough for me to do better.